Hey guys, this is Stephanie. I'm with mPower Physical Therapy. Me have been. I'm going to share a little bit about me. First of all, we're just really excited that you guys have come to join this talk. It's a really good one because I can't do the neck without the shoulder, and I can't do the shoulder without the neck because they really are connected. And we have some just really good information to share with you that kind of can explain it. It's often why we find people that should have never had surgery that did have surgery because they were working on the wrong area. So a little bit about me. I'm a physical therapist. I've been a physical therapist for, gosh, almost 20 years. And I grew up super, super active, always interested in learning about the body. Went on to, after I played soccer in college, and after college, I got my master's in exercise physiology and then physical therapy. And then I went on to get my diploma in McKinsey. So really all that really means is nothing other than I just love to learn, and I'm always curious about the body. And that's ultimately what's, made this place kind of a unique place, because I'm always asking why. Like, why is this happening? Where is this coming from? Like, what are you doing throughout the day that's creating some of your problems? So we also have Ben here. So I'd love, Ben, go ahead and share a little bit about yourself.
So I joined the practice about almost a year ago now, and I've been a physical therapist for more than 5 years. I really like to talk about the neck and shoulder, really, because it's such a disabling thing if you're having problems in your neck or shoulder, or even headaches coming out of the neck. And so I know that we can make a big difference in people's lives as far as just being able to give them back some control over that. So what really got me into physical therapy was, I was a patient myself. Back when I was in high school and college, I tore my ACL 3 times, and I was really like, oh, this is something that I could do. But then, you get out into the field and it's a little different than you think. You can't really spend the time that you would like to with people. So that's what kind of led me down this path to end up with Stephanie and be able to actually, make some changes in people's lives.
So some of the things that we are going to talk about are why pain pills, medications, and injections and surgeries do not always work, why MRIs and imaging leads down to more unnecessary procedures, and what most other healthcare providers miss in treating this area. I know they're really common things that we talk about, but it just relates so much to all of the body parts. So how can we help? So I always like to say where the site of the pain is often not where the source of the pain is. And so also, at the end, stay tuned because we have a special offer for you guys. So let's go into some of the causes of neck and shoulder pain. I always like to tell people you've got to get the mobility back first before you can get the stability. So often when we see, like, you go to other physical therapy offices, they'll see a shoulder pain, and all they want to do is go to the shoulder and start working on strengthening exercises. They see the diagnosis, and they're like, oh, okay, it's a rotator cuff. Let me go and start doing rotator cuff exercises. And really, I'm asking, like, well, is it a rotator cuff? Like, maybe it's something else. It could be coming from the neck. Like, we've got to figure out where the problem is before we can get into doing any kind of strengthening type exercises. So a lot of shoulder issues can come from the neck, but they also can come from the thoracic spine. And so you really have to go and start ruling those out first. This also happens because of repeated movements and our movement habits that we have. So, we are always at a computer, typing, always looking down on the phone. And so we're always doing these repeated posture type movements. And that also creates problems with the neck and the shoulder. And then muscle tightness. So a lot of times, people will say, like, oh, I just need a massage. Here's my muscle tightness between my shoulder blades. And that's really a telltale sign there's something going on with your spine. Rarely is it that you get that tightness and that's all that it is. Usually there's something else going on that's creating that tightness. So that's why a lot of times when you get massages and you go to places that doesn't work, like it comes back, within a day or within like a few hours. Then it's because you're just treating a symptom. And then again, the posture habits, kind of what I talked about, that we're always, doing things where we are looking down and, using our phone and sitting all the time. So poor posture habits really create a lot of these problems. So Ben, why don't you, I know this is like your favorite body part. So talk a little bit about like how the shoulder and the neck are all connected.
I think really what you see, like when you're moving your shoulder, you need a little bit of cervical or thoracic mobility to get to in-range movements. And then there's also the component with the thoracic spine of your shoulder blade being able to kind of glide across your ribs and your thoracic spine. So if you don't have that mobility, then it can kind of create some issues with, you know, being able to move your shoulder to those end ranges, which would in turn, you know, you get all these kind of muscle compensations, things like that, especially when you can't move your shoulder blade the right way. That's really the main thing that we'll see is, you know, that people will have these weird, you know, kind of muscle coordination patterns when they're trying to move their arm and, you know, above their head or out to the side, or, and we'll really see that kind of the issues there a lot of times are around the shoulder blade.
Yeah, I mean, so like all the muscles that attach into like through here from the spine to the shoulder blade are, you know, also attach into the spine. And, you know, a lot of times because we're always in this posture of typing, like our shoulder, our like mid spine gets really rounded. And when that happens, it makes it really hard for the shoulder blade to really move through there. And it creates more problems than we think. And you don't have to have shoulder issues to have a neck issue. There's many times where it's just only in the neck, but they really are connected. Common patterns that we see with people that start having shoulder issues is pain kind of along the side of the arm. You'll have pain in the front, like in the where the pec muscles are, and then you'll get pain close in the back part of the shoulder. And those are really common because that's just kind of where everything gets recruited when that shoulder is kind of more forward because it can't glide back. So those are common things that we find with the shoulder and the neck. Typically between the shoulder blade, when you have pain between the shoulder blade, that's pretty much, you know, that's the first place that I want to go to. It's not soft tissue that I want to go to. It's okay. We've got to look at the mobility of the spine so that we can get everything moving correctly. So talk to us a little bit, Ben, about like why medication injections don't work.
Well, there's, you know, like the slide says there's 3 ways we really feel pain. It's either mechanical, thermal, or chemical. Thermal is more like, you know, a sunburn, something like that. So that's kind of, we won't worry about that one. Chemical is more like that inflammatory type of pain. It doesn't really change with position. It's kind of after you roll your ankle and it's stiff and swelled up. There's really nothing you can do to change those symptoms because it's just the chemicals that have been sent there to help it heal. Mechanical pain is more like, you know, if you're bending your finger back like so, really just that stress that's on the joint. If we take that away, then the pain goes away. So the reason that medications and injections can't really touch that is because they're there to treat the chemicals. So you treat chemicals with chemicals, and it's really not ever going to touch that mechanical pain because that's not the source of it.
Yeah, and we can pretty much tell when someone has mechanical pain versus chemical pain because you can ask a few questions, like the questions that, you know, that chemical pain is that constant achy throbby, like you have that kind of toothache. That's the chemical pain. But mechanical pain, like we can change your position and you can make it better and worse. The pain can come and can go. It's not always there. It can't always be there with it being mechanical. But if you can really change and move and make your pain better or worse, pretty much you need to go to a mechanic, like a good physical therapist to kind of figure those things out because that's where the pain is coming from. And you have to get to the source in order to really, you know, figure out what's going on. So let's talk a little bit about why surgeries leads to a lot of frustrations. I know you've had some good cases there.
So the problem with surgery really is that I think a lot of times we jump too quick to it. So, I mean, I think we really owe it to ourselves to, you know, try some conservative options, especially, you know, and, you know, barring all the injections and medications and like that, because we just talked about why those don't work as well. But I mean, the main problem with surgeries is that, you know, maybe that's not if they're going in to fix the structure, maybe we need to go and look at the neck if you're having shoulder pain and really rule that out. And then also, with the spine, one surgery tends to lead to another surgery. So, I mean, you usually start with, they'll go do, laminectomy or like a microdiscectomy or something like that. And then, 5 years down the road, you're waiting in their office again to get a fusion or a 360 fusion. So, I mean, and some of that is where, we didn't really ever get down to the source of the symptoms, but they also never changed the things that you were doing throughout your day that made it come up in the first place. And so that's really the big thing that I think we try to harp on with people is, hey, you have to change your posture habits or your movement habits to really, get around this issue that you're having.
Yeah, that's a big miss. It's kind of coming up in one of our slides because, you've got to get to like, why did this happen? And you don't ever get to that because most of the time when people come in, it's like, I'm not really sure what I did, but I did something. And I don't know, so if you don't know what you did and how it created, then you're just going to go back to those same habits that you did before, which is why a lot of the neck surgeries and the back surgeries lead to more surgeries. But also, we had a person in here who had a rotator cuff tear, supposed rotator cuff tear from MRI, and they tried physical therapy somewhere else. They had a hard time like raising the arm. It looked similar to what you would think a rotator cuff would look like. And but I, when I was on the phone with them, I was asking like, well, what did you do? I'm not really sure. And I'm like, you're not really sure, and you have a rotator cuff tear. Are you really sure that you need this surgery? And I just said, like, could you just please come in? Let me just look at it and make sure. And so we looked at it, and I was like, oh my gosh, no one's ever looked at their cervical spine or their thoracic spine. And, luckily they said, yes, I want to come in and try this because I don't want to deal with this like surgery for 6 months. I don't even know how I'm going to work. Like it's a rotator cuff surgery is a horrible surgery. And literally after the third visit, they were like, canceled my surgery. I'm feeling so much better. They weren't all the way back after 3 visits, but they were well on their way to feeling fantastic and knowing that, okay, I didn't really need this surgery because my range of motion was improving. And now I can actually get to the strengthening part of it that wasn't really working at the other place because it was very cookie cutter, because that's what people do is they just go right to the side of where the pain is. So talk about a little bit, like we just kind of went through a little bit of it, but why MRIs lead to more procedures.
Well, really, when they do an MRI, they're just taking this general picture of you, and it doesn't really give, the clearest picture, I guess, as far as like what the actual source of the pain is. So like the MRI is going to pick up anything that's there. So it's going to pick up any degenerative changes, which really, we have those, that's just a natural part of aging. We're going to have degenerative changes like wrinkles on your skin, except it's just on the inside. So, those things really don't point in any direction usually. There are times when MRIs are needed, if you have a bunch of red flags, big things going on. But for the most part, it's better just to try the conservative option first, save that $1,000 and, try to.
Or more.
Yeah, or more, and just try to get it taken care of from a conservative standpoint.
Yeah, it's not any different than like the example that we just shared before. They got an MRI and it showed a rotator cuff tear. They couldn't move their arms. So like, that's what it is. They did try the conservative route. They just went to a PT that just was like, oh, okay, let's just work on strengthening exercises, and it didn't work. And so like, now let's go and have surgery. So, baseball players that have fully functional, like power throwing, like 90% of them have rotator cuff tears. So just because you have one doesn't necessarily mean that's a problem. Same with neck issues and degenerative changes, like what Ben was saying, like these are just part of aging. So when doctors go and tell you like, you just have a lot of degenerative changes and you just have a lot of arthritis, and then all of a sudden you think, oh my gosh, there's nothing I can do. No, it's not true. Like that, your pain may not be coming from that. That could be just something that has been there and you're hurting because of something else. And figuring out like what that is and where it's coming from. Pain can, the pain and your symptoms and getting you back to being active is totally possible. So here's a big thing of like what healthcare providers like miss. So kind of like what Ben talked about was like lifestyle changes. No one ever looks at like, what were you doing that was creating this problem? Or what is it that we need to offset? Kind of like he talks about the finger going back. Like if we keep on pulling our finger back, you know, that's the problem. Like it doesn't matter if you do surgery, you do injections, or you do things. Like if you're doing this all the time, that's what you have to do for work or whatever the case may be. I mean, you don't have to pull your finger back for work, but you know what I'm talking about, like other postures that you have. We've got to offset that. We've got to come up with a game plan so that you can continue to feel great. But just having a surgery is not going to do that. People also, like we talked about with other stories, is that they only look at the side of the pain. And that's it. They just go shoulder pain. Okay, that's what I'm going to do. Or there's pain between the shoulder blade. Okay, I'm just going to do massage. And then you'll find people that only look at the injury one way, whether it's I'm only going to do massage, so I'm going to do dry needling. Same thing as massage, not same thing as massage, but similar. You're just addressing the tissue. Or I'm only going to do strengthening. Or we're just going to do, you know, some manipulation, and that's it. Like you have to really take it from a whole approach. And there is a process on how things should go, because it's like we were talking earlier. You can't go and do strengthening without getting the mobility back. And we've got to get that piece of it back. And if we miss that piece, then you're not going to get your strengthening back. You're going to be like, well, I feel the same because we didn't get to the source of what's going on. So I know you can't read some of this stuff. It's not a big deal. Some of you guys have already seen Marcy's story, but what I wanted to share with you is like kind of the back end story. Like I talked to her before when she was having issues with her shoulder. Gosh, probably a year, and she didn't come in. And I just kept on following up with her. Probably should have followed up more often, but I didn't. But I still did follow up with her. And every time she was like, I would ask, what, you know, how's your shoulder doing? Oh, it's horrible still. I'm like, so what, you know, what are you going to do about it? Like asking her that. And she's like, well, I'm going to go back to the doctor. I'm like, okay, well, let's talk after the doctor. So we did. And then she's like, well, I'm going to have a rotator cuff surgery because I think that's what it is, because she literally did stem cell injections, PT, acupuncture. I mean, when I tell you she did it all, she did it all, but all they addressed was her shoulder. And so she decided to have a rotator cuff surgery. And I'm like, oh, please come in and see me. Please come in and see me. And she didn't. She had the surgery. 4 months later, four days a week of doing physical therapy, she's worse off than before the surgery. She literally can't even bring her hands up to her head to like wash her hair. I mean, it was, I don't know how she was working. She would wake up almost 2 hours just to be able, because it would take her an hour to get ready because she was so stiff and just kind of warming up to where she could even just get ready. And then finally, you know, when I called, I said, and I was like, well, when you hit your low point, you come into me, it's one of two things. Someone's missing something. And when I saw her, literally her range of motion in her neck didn't look that bad. Like didn't hurt her shoulder at all. Like she couldn't raise it. It wasn't that bad, but I said, I have got to rule this out because it possibly could be. I don't think it is. And I kid you not, we went and did stuff to her neck and she was like, oh my gosh, I can raise my arm up. I mean, she literally within like 1 and 2 visits was 70% better. I was shocked, but I follow my process. I make sure that I hit it. But yeah, this is just something that you just don't want other people to go through. Now she like refers just a ton of people and she tells everyone like, they won't listen to me. And I'm like, you didn't listen to me either. You got to remember, just keep on dripping on them. Eventually they'll want to come in, but she like refers everyone because she does not want anyone to go through with what she went through. So let's talk about like what we should take from this. You know, most injuries don't require surgery or medications. We've saved so many people from having neck surgery and shoulder surgery. Most of the time, no one gets to the source of the problem or why it's happening. MRIs and x-rays do not help in guiding treatment or resolving neck pain or shoulder pain. Seeing a specialist to help you figure out where the source is coming from is huge. And there is hope. There's hope that you can get back to living life again and doing what you love to do. We see it all the time. You know, when people come in here, they've tried everything. Not everyone comes in here not trying everything, but that's a lot of our people. They've tried so many different things and it hasn't worked. And we're able to get them back. I mean, there's very few people where we have not been able to help them. And even if we can't help them, we are still helping them, trying to figure out where they need to go and who they need to see and how they can take care of whatever it is. But I think in like 3 years, we've only sent like maybe 5 people to surgery of all body parts. So just want to just let you know that there is hope. So we have a couple of options for you today. You can come in and talk to one of our specialists for free. And really, that's just to sit down, have a conversation, learn a little bit more about what's going on with you, and so that you can make a better decision about your health. Whether it's you want to come here or you don't want to come here, it doesn't matter. Just helping you make a better decision. Or, you know, for the next 2 weeks, we're going to open up where you can, if you want to come in for a full evaluation, you'll get $50 off the evaluation price if you use it in the next 15 days. So those are 2 different options that you have. I want to share one other story. This was a guy that came in. He was someone who was suffering from shoulder pain. He had tried some other physical therapy, didn't really work. It was kind of frustrated that he just wasn't getting better, but they kind of were giving him the same exercises day in and, you know, as he was going there. So he ended up deciding to come in and seeing us. And you know, he was one that, like, we ruled out his neck pretty quickly, and I was like, wow, it moves fine. It didn't really affect the shoulder. So then we went to the shoulder trying to figure a few things out, but the shoulder stuff that we were getting, he still wasn't able to play with his kids and throw a baseball. And he had said something, and I don't even remember what it was, but I was like, we never looked at your thoracic spine. And we went into and started doing self-mobilizations and some manual work within the thoracic spine, and his range of motion improved, and literally like got back to playing baseball with his sons. That was like really what he wanted to do. He's like, I can't throw the ball. That's a big deal, because I love to play with my 2 sons who love to play baseball. So you know, it really does take ruling things out and figuring things out, because everyone, it's not always the same for everyone. And that's what we do. That's what we're really good at. So again, 2 ways that you can come in and chat with us. We can do a free discovery visit, again, where we can help you make a better decision. And we can do this online if you want to. We can do a Zoom call with you. We can do it over the telephone, or you can come in person. And, or if you decide, like, you know what, yep, I want to do the full evaluation, we'll get you in, we'll give you $50 off your evaluation price if you use it in the next 15 days. So those are your 2 options. Come see us. We definitely can, you know, at least have a conversation. It doesn't cost you anything to have a conversation. And a conversation really can make a big difference in your health. Ben, do you have anything else?
Yeah, I think just, you know, going somewhere where you make sure someone's going to spend the time. And really, if you have a shoulder issue, you got to go to somebody that's going to help, you know, look at your neck and your thoracic spine, because I mean, you can have no symptoms in those areas and that be the source of your shoulder pain. So I think just going to somebody that can take the time, especially, you know, sit down and have a conversation with you about it before, is important.
Yeah, and there's times, like, we collaborate all the time. So even if I'm seeing a patient, I'm collaborating with Ben. If Ben sees a patient, then we're collaborating. We've even had patients where we've done like treatment together, just so that we have 2 brains trying to figure it out. Because ultimately, our goal is to get you back to living the way you were living before, without fear of, like, you know, that you're going to have to slow down, or without the fear of, oh my gosh, I'm never going to be able to do this again. I'm never going to be able to be active or lift weights or play with my kids, or whatever the case may be. That's what we want to do. We want to get you back to living your life. And we do that so that we, you know, if it takes 2 brains, and it takes 2 brains, like that's our goal, is to help you do that. So anyway, thank you so much for coming to this talk. We'll pop in the chat. We'll put the link so that if you want to get a discovery visit, then you can. If not, you can always reach out to us at info@mpower-pt.com. If you have any questions a day later, or something that you want to ask us, just shoot us an email at info@mpower-pt.com, and we can answer anything that you have. Thanks so much, guys.